Welcome friends. Today we are going to learn about hepatitis. After watching this video, you will be able to describe the etiology and pathogenesis of hepatitis. You will be able to name the signs and symptoms of the disease. You will be also able to mention the complications of the disease, and you can suggest diagnosis and treatment. Now let's take a look at hepatitis. Hepatitis, it is the inflammatory condition of the liver. It can be of two types. The first one is acute hepatitis. Acute hepatitis is it lasts not more than for 6 months and it resolves on its own. The second form is chronic hepatitis. Chronic hepatitis lasts for more than 6 months, leading to liver cirrhosis, liver failure, and liver cancer. Mostly hepatitis is caused by viral infection, but other causes include heavy alcohol consumption, certain medicines, toxins, or autoimmunity. Now let's take a look towards the basic function of liver. The liver is responsible for bile production, which is important for digestion. Secondly, it removes the toxins from the body. It also helps in excretion of bile, cholesterol, hormones, and drugs. It is involved in breakdown of carbohydrates, proteins, and fats. It synthesizes blood proteins, blood clotting factors. Also, it stores glycogen, minerals, vitamins, etc. in the body. Now, as I told you that hepatitis is mostly caused due to virus, and depending on type of virus which cause hepatitis, hepatitis is classified into 5 types. The first one is hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Now, hepatitis A is caused by hepatitis A virus, which is also called as HAV. Mostly, hepatitis is a food and waterborne disease. That is, if the stools of a person who is suffering from hepatitis A gets mixed with potable water, then whoever consumes that water is going to attract this disease. Hepatitis A is preventable with immunization, and mostly immunoglobulins are used for the same. Hepatitis A is caused due to hepatitis A virus, which is RNA virus. The next class is hepatitis B. B is caused due to hepatitis B virus, which is also called as HBV. Hepatitis B is the most severe form of hepatitis, and it is transmitted sexually. It can be get transferred from infected mother to the child during pregnancy or childbirth. It also spreads through infected blood. It is preventable with immunization and antiviral drugs. Mostly interferons, adifovir, and lamivudine are used. Out of all the viruses, only hepatitis B is a DNA virus. Now, what is hepatitis C? Hepatitis C is caused due to hepatitis C virus, that is HCV. It is going to spread through infected blood which comes in contact during needle sharing in drug addicts. It, it is also treated using antiviral drugs, mostly interferons. Combination of interferon and ribavirin is also used. Again, hepatitis C is caused due to RNA virus. Hepatitis D is caused due to hepatitis D virus, HDV. It can affect people who are already infected with HBV. As such, hepatitis D is not going to attack the person when hepatitis D is alone. And hepatitis D is also RNA virus. The last type is hepatitis E, and it is caused due to hepatitis E virus, that is HEV. This disease, it occurs due to food and waterborne. Then it is preventable with immunization, and again hepatitis E is RNA virus. Now let's see hepatitis in detail. First is hepatitis A. Hepatitis A virus's incubation period is from 15 to 45 days and it lasts for 1 to 2 weeks. It spreads by fecal-oral route. Spread is related to close personal contact, like in crowd, poor hygienic and sanitary condition, stored contaminated food and water. It is going to affect age group from 5 to 14 years, and this is the least threatening type of hepatitis. The virus is icosahedral and it is non-enveloped and it contains RNA as its main genetic material. This virus is present in liver cells, stool, and blood. Antibodies are produced against this virus in the body and it includes IgM and IgG, which fights the infection. The symptoms of hepatitis A include dark urine, light stools, fatigue, nausea, vomiting, abdominal pain, fever, and jaundice. How it can be prevented? You have a vaccine for hepatitis A whose lifespan is for 2 years. You have to wash your hands with soap and water after using bathroom. You have to use bleaches to clean the surfaces that may be contaminated with the feces. How are you going to diagnose it? The first is you have to go for a blood test to determine IgM antibody. Then you can also go for virus determination in the liver cells, blood stools, and bile. Now let's take a look at hepatitis B. Hepatitis B, it has got longer incubation period, which is from 30 to 180 days, and it is transmitted parenterally as in recipients of blood and blood products, drug addicts by IV route, then renal dialysis patients, hospital workers who are exposed to the blood, and it also is transferred from mother to the child during birth, and it might get transferred during sexual contact. It can occur at any age, can cause more severe form of illness as acute and chronic hepatitis B. It progresses to cirrhosis, liver cancer, liver failure, and finally death of the person. The symptoms include, in some patients there are no symptoms or some are going to show mild flu-like illness. There is development of jaundice, there is arthritis-like symptoms, there might occur liver failure and death due to liver failure. How are you going to diagnose it? You can go for blood test for HBs antigen. Okay, it is present on the surface of that virus. Anti-HBC or HBC antibody is formed against that antigen in the body. Then IgM anti-HBC antibody is also formed in the body. Anti-HBs antibody is formed. Then HBcAg, it is active viral reproduction in the liver. At that time it is produced. Anti-HBe, it is produced when the infection is decreasing. And hepatitis B DNA, measurement of actual virus in the blood is important resource. You can monitor the infection during the treatment. Now we'll take a look towards hepatitis B virus. As I told you, hepatitis B virus is only a DNA virus. It comes in two forms. The first one is small particle. It might be spherical in shape or filamentous, and it measures from only to 22 nanometers. The second particle size is little large, and it comes in spherical form, and its size range is up to 42 nanometers. Now, this is your hepatitis B virus. This red content is the double-stranded DNA. The blue protein capsid shell contains the HBcAg core antigen and HBeAg hepatitis B antigen. The outer membrane, it is studded with glycoprotein spikes and which act as antigen that bind to hepatocytes containing HBs antigens. Now, let's see how this virus enters in the body and it undergoes replication. This process occurs in six steps. The first one is attachment. The virus enters the cells using endocytosis by binding to a receptor on the surface of the hepatocyte. Next is penetration. The viral membrane merges with the host cell membrane. Then it is going to send only its DNA material and several protein into the host cell, and remaining part, the capsid and the shell portion, it remains outside the host cell. The third step is uncoating. Here, the HB virus uses the RNA to replicate. The HBV, it has partially double-stranded DNA that must be made into fully double-stranded DNA. The core proteins that separate from the partially double-stranded viral DNA and make covalently closed circular DNA, that is cccDNA. This cccDNA becomes the transcription template for the mRNAs. Next step is the replication. Here the cccDNA is used for replication. mRNA is used to make new copies of the genetic material. The next step is assembly. Here the mRNA are processed and new progeny virions are formed. They are returned to the nucleus where they are recycled and make additional virions. Then the last step is release. The DNA is synthesized by reverse transcriptase and new virus is sent to the cytoplasm. This is the new virus which is formed. It is moving towards the cytoplasm, then towards the cell membrane, and ultimately it is going to fuse with the cell membrane and it is released from the host cell. Now again, this newly formed virus is ready to attack another hepatocyte. So this was all about hepatitis B. Now let's see what is hepatitis C. It occurs due to blood transfusion related cases, blood products, hemodialysis, parenteral drug abuse, accidental cuts, needle pricks in health workers. The incubation period for hepatitis C virus is 20 to 90 days. It can progress into hepatitis B. There is a persistent infection of chronic form. The symptoms include mild flu-like illness, or sometimes there are no symptoms, and no jaundice is seen in such patients. The diagnosis is based on anti-HCV, that is antibodies produced against HCV, and test is used to determine this hepatitis C viral RNA. Now what is hepatitis D? Hepatitis D is caused due to HDV virus, which is a defective RNA virus, and it basically requires hepatitis B for reproduction. So it cannot infect a person who is not infected with hepatitis B. So the patient has higher risk of suffering from severe hepatitis. It spreads through any person who comes in contact with the infected blood, contaminated needles, sexual contact with an HDV infected persons. The symptoms, they are more similar to HBV. Vaccinating with HBV vaccines can prevent infection. No special HDV vaccine is invented. The last type of hepatitis is hepatitis E. Hepatitis E is caused by HEV virus. It does not lead to chronic hepatitis. It occurs by contamination of food and water. Epidemics spread through contaminated water through sewage after monsoon and floods. Young and middle-aged persons are mostly affected. 15 to 60 days is its incubation period. Acute phase is mild and there are very minor chances that it may develop into sudden and severe liver disease, like liver transplant may be needed. The symptoms, they are similar to HIV. The person is going to show you flu-like aches and pains and jaundice. Now let's take a look towards alcoholic liver diseases. It is one of the 10 leading causes of the death in the world, and it occurs due to overconsumption of alcohol. Now why it occurs? Because of the buildup of fats and scarring of the liver tissues. The main cause of liver disease in the Western world is alcoholic liver disease. What is liver cirrhosis? It is chronic progressive disease of the liver which is characterized by diffused damage to the cell with fibrosis and nodular regeneration. Some disease, they damage the liver cells and kills them, after which inflammation and repair causes scar tissue to form. The cells which do not die, they continue to multiply to replace the dead cells, and hence they are going to form nodules. Nodules are nothing but clusters of newly formed cells. The scars prevent blood flow through the organ and prevents its working, ultimately causing hypoxia to the liver tissue. So if this is your normal tissue, normal liver, then you are on high consumption of alcohol, your liver becomes like this, and this is only due to inflammation, scarring, tissue death, and hypoxia. Now let's take a look towards the etiology of liver cirrhosis. The factors which are responsible are: first is chronic alcoholism, second is chronic hepatitis C, next is chronic hepatitis B and D, autoimmune hepatitis, and inherited disease. Now let's take a look towards its pathogenesis. When you consume a lot of alcohol, this alcohol moves inside your liver. Here the alcohol, it undergoes oxidation, and two steps are two steps occur. Now let's take a look towards what two types of reactions are going to take place inside the body once your alcohol is oxidized. The first is the ethanol. It undergoes oxidation to produce ethanol, and in this NAD is converted to NADH. The acetaldehyde is very toxic to the body. The conversion of ethanol to acetaldehyde take place by using two types of coenzymes. The first is catalase and the second is P450 enzyme, which is present in the liver. This toxic acetaldehyde is again converted to acetate by using NAD. NAD is converted to NADH here, and the enzyme which is responsible for conversion of acetaldehyde to acetate is ALDH, that is acetaldehyde hydrogenase. Okay, now this acetate which is formed inside the body is converted to acetyl coenzyme A. This acetyl coenzyme A is converted to carbon dioxide and water. Now what is the ultimate effect of consuming excessive amount of ethanol is that first there is reduced level of NAD, because you can see here for conversion of this ethanol to carbon dioxide and water, your body is going to use NAD. Okay, so automatically the level of NAD is reduced in the body, and what is the result of reduced NAD? There is decreased fatty acid oxidation. Again, you can see NAD is converted to NADH. So the production of NADH is increased and it causes fatty acid synthesis. So what is happening? Fatty acids are being synthesized in the body and fatty acid oxidation is reducing. So it results into higher levels of fatty acid in the body. So the liver is responsible for compounding this increased fatty acids into glycerol and triglycerides. Once they start to get deposit to the hepatocytes, it is going to cause fatty liver, which has direct hepatotoxic effect. Now, what is the ultimate effect of this hepatotoxic effect of alcohol? It is mostly due to its metabolites, especially acetaldehyde. As I told you, it is highly toxic. In case of chronic alcoholic patients, there is increased acetaldehyde level in the blood. Now this increased acetaldehyde, it is responsible for production of protein aldehyde adducts. These protein aldehyde adducts are extremely toxic and they are going to cause you cytoskeletal and membrane damage and bring about hepatocellular necrosis. Also, this acetaldehyde is responsible for formation of malone dialdehyde acetaldehyde. It is an adduct which produce autoantibodies and initiate autoimmune response. So we can say that alcohol causes immunological attack on hepatocytes. The next is oxidative stress. Oxidation of ethanol leads to generation of free radicals, which causes oxidative damage to the membrane and the proteins. Next, chronic ingestion of alcohol results in increased oxygen demand by the liver, resulting in hypoxic state, which causes hepatocellular necrosis. Also, it is going to damage the intestinal cells. Now we will take a look towards diagnosis. First resort is the blood test. You have to check the blood for elevated transaminase. In case of liver cirrhosis, there is increased level of HGOT as compared to HGPT. There is rise in serum gamma glutamyl transpeptidase. Also, there is elevation in serum alkaline phosphatase. There is hyperbilirubinemia, hypoproteinemia with reversal of albumin globulin ratio. There is prolonged prothrombin time and partial thromboplastin time. The person suffers from anemia. There is neutrophilic leukocytosis in the alcoholic hepatitis and in secondary infections. Now let's take a look towards the clinical features. The first clinical feature is ascites. The second is bruising and bleeding. Third is mental disturbance, and fourth is itching. The treatment is, as you know, liver cirrhosis is not curable. You cannot reverse the effect. You cannot reverse the damage which has happened to your liver, but you can go for some small measures. The first is the treatment. It is going to be dependent on the cause. In case of severe alcoholism, the person has to abstain from alcohol. He has to switch to healthy diet. He has to go for light physical activity. He has to restrict sodium diet. You can go for diuretics and laxatives. So this was all about hepatitis. Thank you for watching.